In this video, I'll talk about a medicine called Metformin that is used to treat insulin resistance. We've talked about many things that can be done to improve insulin resistance. Maybe you've tried all those things, or your doctor recommended that you consider treatment with Metformin, but you don't know a lot about it. Metformin is a medicine that works to improve insulin resistance. When the dose is correct, Metformin can help the cells become more sensitive to insulin, going from a triple lock to a double lock, or a double lock to a single lock. Metformin is used to treat type 2 diabetes. Remember how in type 2 diabetes the pancreas can't make enough insulin to unlock all the locks, so the sugar ends up having to go high? If you give someone with type 2 diabetes Metformin, the locks are reduced and the insulin that is present is enough. The sugar can move out of the blood and into the cell. The other name for Metformin is glucophage. Gluco is short for glucose or sugar, and phage means eat. I like to think of it as eating up the extra locks on the cells. Metformin has been around for more than 60 years. It is among the top 10 most prescribed medicines in the United States and is the most widely prescribed diabetes medication in the world. The formal indication for Metformin, meaning how it has been tested and approved, is to treat and prevent type 2 diabetes. Metformin is also used to treat and prevent polycystic ovarian syndrome and to treat insulin resistance. We know that it is safe in children and adults, it is inexpensive, and there are many different types of brands. There are two basic types. There is a sustained release, also called extended release. This can be taken once a day, has fewer side effects than the regular release, and won't work if it is broken or halved or crushed. It comes in several different dose forms. The regular release Metformin must be taken twice a day, and it has more side effects such as diarrhea, belly pain, and nausea. It can be crushed and broken, and also comes in different dose forms. The sustained release is better tolerated and easier to remember to take once a day. Typically, your doctor will tell you to gradually increase the dose. So if you are prescribed the extended release, oftentimes it is recommended that you take one tablet once a day with food and a large glass of water. This can be taken at any time of day, although most people prefer dinner. Once this dose is tolerated, which can be 1 day or 2 weeks after starting, then you can increase to 2 tablets daily. If you are prescribed 3 tablets daily, then once you tolerate the 2 tablets daily, you can increase to 3 tablets daily. It may take longer to get used to higher doses, but side effects usually go away within 2 weeks or become tolerable. The extended release tablets can be taken all at the same time. It is not recommended to start with 3 tablets daily all at once because often this causes abdominal pain and nausea. By starting slowly and progressing as tolerated, your body gets used to any side effects and then can be receptive to the positive effects, which is the goal. If you are prescribed the regular release, then oftentimes your doctor will tell you to take 1 tablet once daily with food and a large glass of water at any time of day. Most people prefer dinner again, Once you tolerate this dose, which can be as soon as 1 day or as long as 2 weeks later, increase to 1 tablet twice a day. If you are prescribed a higher dose, then once you tolerate 1 tablet twice daily, increase again. Like the extended release, it may take longer to get used to higher doses. Side effects of the regular release may be harder to tolerate for some people. Regular release tablets can be cut in two and also can be crushed and put in food. The most common side effects, as I've mentioned, are nausea, diarrhea, and belly aches. In my experience, there are about 15% of people who have no side effects at all. Most people have a few side effects that are temporary. Some people have mild and ongoing side effects like diarrhea or a little bit of belly aches, but it's tolerable. And there are some people who simply cannot tolerate it. What I tell my patients is that metformin is cleared through the kidney. Sometimes a contrast dye is given through an IV for certain X-ray studies, like a CT scan, for example. Contrast dye that is given when you're having an imaging study can affect your kidney function temporarily. So if you need an X-ray study with contrast dye, I recommend, if you have knowledge that you're going to have this imaging study, that you stop the metformin a day ahead of time and for the next 2 days. If you are very ill or hospitalized, metformin is often stopped during this period as well. How will you know if it is working? Well, it is working if what you are treating gets better. So in the case of insulin resistance, if you have carb craving, that will decrease. If you have hunger after eating, that will decrease. Your headaches may become less frequent. Your nausea and energy can improve. If you're experiencing rapid weight gain, that may slow or stop, especially around the waist area. And the acanthosis will become less dark. That's the dark skin in your armpit area or around your neck. If there is little to no effect, a higher dose may be warranted. If there are intolerable side effects, the dose may need to go down. If the reason for the insulin resistance is removed, such as a medication that was causing insulin resistance is no longer being taken, the dose can be decreased or stopped. As this is a prescription medicine, these decisions will be made with your doctor, of course, as every individual is different, and the need for this, the dose, and the precautions will vary from individual to individual.